China is racing to build a new quarantine center in Hebei province to deal with a surge in COVID-19 infections. The complex will be able to isolate several thousand people, mainly close contacts of confirmed cases. Once completed, there will be 3,000 makeshift wards. It's located in Shijiazhuang, the provincial capital of Hebei, the location of a major COVID-19 outbreak. At the same time, China has recorded nearly 150 new COVID-19 infections. It's the highest daily number of new infections in more than 10 months. The majority come from Hebei province, while 43 are from northeastern Heilongjiang province. Over 28 million people in both provinces are already under lockdown. Residents have been urged to stay home and avoid non-essential travel, especially during Chinese New Year. Olivia Song joins us live from Beijing for more on this. Olivia, another day of record cases in China. Now authorities are building a quarantine center to deal with it. Is this going to be enough?
Well, yes, certainly this resurgence is a source of concern. Another daily high, 144 new cases, a daily high in the last 10 months. But we have to put it into context. This is still a much lower number compared to the number of cases that China had been handling during the peak of this outbreak last year, when the number of confirmed cases daily was in the thousands. But it's still a source of concern. Hebei province has reported over 500 confirmed cases since the start of this year, and the speed at which this is spreading is definitely worrying authorities, and that's why we see that they are racing to build this mega quarantine center, which will have 3,000 rooms, and it is only the first of such projects to build more centralized quarantine facilities, building new sites as well as renovating existing sites to house more people. And the reason why this is being done, we have to look into the nature of this outbreak. The bulk of the cases in Hebei province, in Shijiazhuang, most of them are in the villages, and most of them are of elderly people with chronic diseases. And this comes as authorities have warned about loopholes in prevention efforts in the rural areas. They say that health authorities, even though they have ramped up, nucleic acid testing and testing for the virus in the villages, doctors lack the ability to identify the coronavirus, and the awareness to report these cases is still lacking. And so that is a source of concern. In addition, authorities are not taking any chances as we approach the Chinese New Year period next month. Typically, that's when we see millions of people travel across the country. This year, we are expecting fewer railway trips to take place. Authorities say about 296 million passenger trips are expected, as authorities are encouraging people to stay put and to not travel. And this is down from 410 million trips in 2019 before the COVID-19 pandemic hit.
Ollie, China has allowed the entry of one expert from the WHO's COVID-19 probe team. What about the rest?
Well, Steve, yesterday we had heard that 2 members out of the 15-member WHO team had not made it to Wuhan City after they tested positive for COVID-19 antibodies in Singapore, where they had flown from. This had indicated that they may have been infected recently with the COVID-19, or they may have, they may actively be infected. But the latest we are hearing today is that one of the experts, one of the scientists, has undergone another test, and now he has tested negative, and this is what the Chinese Foreign Ministry had to say.
出于对世卫组织工作的支持，中方同意对有关专家进行第2轮 IgM 抗体检测。结果显示，英国专家检测为阴性，卡塔尔专家仍为阳性。我们已经同意英国专家来华，我们将继续同世卫组织 就相关事宜保持沟通，为双方开展溯源合作共同做出努力。
Now, Now, the WHO team is currently undergoing a 2-week quarantine in Wuhan as required by China for all incoming travelers. A member of the team had written in a tweet, though, that work has already begun, and the team is said to have been in teleconference meetings with their Chinese counterparts, even while being confined in their hotel room. Now, after the 2 weeks, the team is expected to be, outside in the city conducting their field work, where they say they hope to be able to speak to early COVID-19 cases, people in the hospitals, research institutes, as well as that seafood market where the virus is believed to have first emerged. But the team has said that there won't be any quick or easy answers. There may not even be definitive answers as to the origins of the coronavirus. After all, it's been a year since this outbreak began, and when we were last in Wuhan, people are telling us that, life has returned pretty much back to normal. And even with the resurgence of the virus in China, this is what the residents in Wuhan had to say.
武汉也是一开始疫情重灾区嘛，所以现在对这方面，所以特别警惕。包括刚才说的那个，其实做的措施都相当到位，所以我倒不太担心这个问题。
如果再出现石家庄那样子的疫情，我觉得不太可能。但是我们还是市民还是得注意防范。
Now, the WHO says that it is hoping to leave the politics out of this investigation, but as we have seen, this has proven to be difficult. China has been accused by countries of an initial cover-up during the outbreak, while China, on its part, has continued to push the narrative that the virus may not have originated from China.